Christie. Well, Christie mentioned a little bit about the Medicaid opt-out, and several states have been looking at this. It just so happens that some of the governors and states have been talking about it over the past 3 or 4 weeks, leading to a number of articles in the newspapers. And so I happened to call the chief of policy of one of the governor's staffs to find out, the governor's been talking a little bit about this. Have you really been crunching some numbers? Do you know if we can actually do this? Is this a doable thing or not? And she said, well, really the governor's kind of getting ahead of the policy staff here because we really haven't taken a look at it yet. And that got me to thinking, well, maybe I ought to do a little thinking about if a state was actually going to opt out of Medicaid, what would that do? What would it look like? How would they be able to do it? It is a problem, as Senator Lillenquist pointed out. There is so much money going into Medicaid right now. Nearly 50 million Americans are in Medicaid in any given month, about 58 million over the course of the year. Medicaid spends 50 to 76, the federal Medicaid dollars spend 50 to 76 cents of each Medicaid dollar spent out there in the states, so states would lose a significant amount of money if they decided to step out. And of course, $340 billion in the budget for both federal and state money on Medicaid. So there's a lot of money and a lot of people to be considered there. So what could states do if they wanted to try to, if they wanted to figure out some kind of strategy here? Is it possible? Is it doable? Is it advisable? In terms of is it advisable, I think the answer is no. If there is any way that states can work with Congress to come up to a solution to resolve the problems that Medicaid is imposing on the new law, they should try to do that and resolve the issue some way. Is it doable? Probably. But it would mean a very difficult decision for the states, and there would be a lot of tough choices to be made. If you were trying to work with Congress to come up with some kind of solution, the best solution would be for Congress to simply block grant the money to the states and give them a lot more flexibility to do what each state feels like they need to do with it. My guess is you would find almost every state would jump at that opportunity, Republican or Democrat, to have more flexibility and be able to take their Medicaid allotment and use it within the state as they saw fit. Interestingly, there has been some movement at HHS in this regard. Rhode Island managed to get a waiver not too long ago, a few years ago, which allows it, and basically what they said was, we will cap the Medicaid reimbursements coming from the federal government, but in return for that, we would like some more flexibility. Now, it's not a lot of flexibility. But Rhode Island is saying that they've in fact been able to save money by doing this. I think about $158 million or so over the last 18 months by having that additional flexibility, even though they're going to be getting less money. Getting that flexibility along with something like a block grant or some portion of a block grant would be the best way to go. Well, what if the government isn't going to do that? Well, they could also consider, a state could say, well, then we're just going to opt out. We're going to focus on the long-term care issues out there, and we're going to let those who use Medicaid for health insurance move into the exchange, get the subsidies in the exchange, and they'll just operate in the exchange. And the state will spend its money, the money it has left because it's not in Medicaid, on the long-term care population. The problem is it's not entirely clear that the law will allow them to do that. Democrats have been saying that we did not intend for Medicaid-eligible people to be able to go into the exchange and get the subsidies. And at least as far as I understand right now, this is going over to HHS and they're going to have to rule on it. We don't know which way they'll go. If they rule against it and say the states can't do it, then maybe that's an option for Congress to say, well, we're going to move legislation that will allow states to take over the long-term care, completely fund that, and then let their Medicaid populations move into the exchange. Well, what if we don't move in that direction? What if a state is just going to opt out? Here's the question you have to ask. If the federal government funds 50 to 60 to 70% of every Medicaid dollar spending out there, can you as a state get by on covering the people who need health insurance, long-term care, and disability with maybe 30 to 50 cents on the dollar that you had been spending, because that's all you've got left. A couple of options that you might consider. On the health insurance front, Governor Phil Bredesen of Tennessee was facing a similar kind of problem with their TennCare program. 3 or 4 years ago, he decided the state simply could not afford this anymore. They decided to make a radical change, dropped thousands and thousands of people off the TennCare rolls, created a program called Cover TN, which is simply a limited benefit health insurance policy. The governor's been going around talking about this and how well it's been working for these. Now, this is primarily for working people who are lower income, but they set up a policy, $150 a month. It was split between the employee, the government, and the employer. And they would, so about $1,800 a year, they got a policy that had a $25,000 maximum, had preventive care in there, had prescription drugs in there, generic drugs and so forth. So it was a very good, but it was a front-loaded policy. It provided for most of the things that you need up front, but if you need a heart transplant, it's not going to be there for you. But it was much less expensive and much more affordable. States could consider moving into something like that with their health insurance, with that low-income population, and providing them with some kind of limited benefit policy. You can get those for less than $2,000 a year. I've been checking with insurers out there, and it's easy to find those things for less than $2,000 a year. It would create an affordable way to provide at least some basic health insurance coverage. What about the long-term care population? That's going to be a challenge also, but most states have not done the due diligence in order to get the people who are getting Medicaid benefits for nursing homes to make sure that all those assets have been used. So I talked with Steve Moses of the Center for Long-Term Care Reform. He's got several suggestions, and he's been writing papers for the states on this. Just recently published the one on Rhode Island, but states are contracting with him to identify what they might be able to do. He says, first off, you need to lower the asset range. He said, depending upon the state, you can have up to $500 to $750,000 in home equity before you would, that would be untouched by Medicaid. He tells me the United Kingdom, their asset test there is about $37,000. So if you lower that asset test and require people to use part of that home equity as a way to fund the long-term care, the nursing homes, the state will begin to save money. They could also look at a reverse mortgage. We're seeing a lot of those advertised now, but if the state required a reverse mortgage, it allows a family member to stay in the house until the person passes away, but they're able to use the equity in the house, and that's where most of the money is. Roughly 80% of seniors, over 80% of seniors own a home, and I think 70% of them own that home free and clear. There's a lot of assets there that a state could use, and that's actually not a bad way to go, irrespective of opting out of Medicaid. So there are a couple of choices that states could look at. I think you could probably get to roughly cut 40, 50, 60% of what you were spending if you did those two options. But it would be a very difficult choice. And the real reason I think for states to consider to talk about this and actually crunch the numbers is to force Washington to understand that they are serious about the Medicaid problems and that something needs to be done. The ideal solution is to have Washington address the problems, not to have the states actually opt out of Medicaid. With that, let me stop, and we've got a little time for questions, about 10 or 15.